I think that's a very good question. I really like that you asked the question, are we too late?
We can link climate change to health in many folds.
One of the most important things about this conference is that it has rechanneled the attention and the focus of the global community towards climate change.
Food for people, not for profit. Water for people, not for profit.
The delegations here at COP, they've all said that climate change is the thing that will threaten health the most in the coming years.
Addressing climate change, actions that we take for climate change, just as actions that we take for the protection of nature, are actions that we are taking to safeguard our very own health.
For MSF, we focus on the impacts on human health and well-being.
We are able to engage with farmers, working with government, and we're able to engage farmers to teach them about smart agriculture that is responsive to the current situation.
UNDP is present in over 170 countries. We have the #1 implementer of vertical funds of the Global Environmental Facility, Global Climate Funds. Obviously, one of the things that UNDP does is really work with government to put those plans into action.
How are you gonna convince the people on the ground about how serious this issue is? At the same time, how would you convince governments?
Yeah, it's easy and not easy at the same time. It's easy because you have to do this together with many other actors. So the science that shows these impacts is already being made. It's out there. It's guiding decision making at places like COP. And so for actors like MSF that do a lot of the medical and humanitarian implementation, for us it's just about bringing what we witness and what communities tell us into these spaces that coincides and correlates with the scientific data.
UNDP is really a flagship sort of global campaign or action, to be precise. It's really what we call the climate promise. So we're trying to look at governments committing to reduce emissions as much as possible. So that every country declares their NDCs. We are working with over 120 countries around the world to increase the targets so that more and more action is taken.
The WHO works very, very closely through its 140 country offices. We work with member states to support member states, but we also work with communities to help build up and scale up their best practices and disseminate them through advocacy, through multi-sectoral partnerships.
This COP27 to us, we take as a platform both for learning but also to showcase, to tell the world what we do. We do not only appear when disaster has happened. We work with government to do anticipatory action, to do early warning action. So we work with the government to strengthen the early warning systems.